Hello, I'm Mabel Jung. Thanks for joining us. I'm here now with Johnna Torsone, and she's with Pitney Bowes. And John, I really wanted to talk with you today about your company always taking a look at your benefits and your wellness programs to ensure that you're helping your employees to become more and more healthy. What are some of the things that you've looked at in the past that have improved, and what do you still need to work on?
Well, let me give you a little history lesson. We started this probably 15 years ago when the CEO said to me as the head of HR, you need to meet the needs of your employees and you need to make sure this cost curve bends down. So we began a journey of understanding a story of what is the health of our employees, not just when they get sick, but how do we prevent them from getting sick and how do we manage that? And we did it first by doing quite a bit of analysis on what were the drivers of lack of health in our employee base. And we found that 4 or 5 chronic diseases were the primary drivers of 80% of our cost. And it involved predominantly 20 to 25% of our employees.
And you mentioned that asthma,
diabetes, cardiovascular, lung issues, things like that. So we had to make some decisions. How do we make it appropriate for employees to engage the system optimally in order to prevent them from getting more complicated sicknesses later on? And so one of the things we did was look at the design of our plan. And how do we make it easy for employees to do preventive type things to keep them from getting what we call high cost claimants down the road. And we removed some of those barriers. For instance, when it came to asthma, we made it very inexpensive, almost non-expensive for an employee to use asthma drugs in order to stay on a maintenance trend. And we found that as a result of that, our emergency room visits for complications related to asthma went down significantly.
What still needs to be tackled today? That was 15 years ago.
So well, this is a continuing issue. Your employees change, you have to keep monitoring, you have to keep looking at the health of your employees, what drives them, and how do you reach them from a behavioral perspective. And so we reach out to them, we do a lot of education. Today we're using much more social media to reach them. Of course, we always still use mail for employees that need that or because of requirements from a regulatory perspective. So it's a multi-dimensional approach. And we try to design it in a way that incents them to do healthy things. For instance, we have a living project website. We give people reductions in their premium if they do a health care assessment, if they engage in a weight loss program, if they engage in a smoking cessation program. All of those things that we know are really important to them staying healthy.
How challenging is it to do your work against the backdrop of healthcare reform? Are there special challenges that are involved with that?
I think that the most significant challenge that I think I face, as many of my peers face, is the uncertainty. It's hard to plan for the future of healthcare in an employment setting where we're not totally sure where that's going to go. Because healthcare, in many cases, is a significant part of the value proposition that many of us provide to our employees. Why? It's a differentiator. Why do you come to work for a company like Pitney Bowes? One of the elements is the quality of what we provide to you in health, not just when you get sick, but how do we reach out to you to keep you healthy. That's a big part of our value proposition. And we're not totally sure as it goes down the road, will we be able to stay in that business for a variety of reasons.
So
and
I
think a lot of companies, well, right now we're just going forward and managing as we always do, trying to, again, design our programs to give healthy behaviors to our employees, to meet their needs when they get sick, and to also make sure that we're driving our cost appropriately, not just for the company, but for the employees as well. But right now, obviously, we're all waiting to determine whether or not the President's healthcare bill is going to survive the Supreme Court or not. And that has some significant issues, obviously, for employers like ourselves. We're then thinking also, regardless of what happens, how do we think about the changes that are going on in the delivery system, such as the organizations that are consolidating, doctors going to work for hospitals, bundling in large healthcare organizations, the work that's going on in accountable healthcare organizations. How do we as employers take advantage of those changes, irrespective of what happens. So we're looking at it in both tracks. Okay. What are the pluses and minuses that we face in the regulatory environment, and what can we do with the reality of what's happening in the market while we're still in the business of providing health care to our employees?
Okay.
So there's so many things I could say about this, but I could go on forever, but
we'll have to
try to hit the high points for you.
Okay, thank you, Johnna. I appreciate you sharing your experience with us.
You're very welcome.
Thanks for watching. I'm Mabel John.